recording.
Hello, my name is Kimberly Jones, and I'm going to tell you today about my clinical capstone I did in the perioperative area at UK Chandler. So in the perioperative setting, my practicum setting was I worked with the educational manager, Kim Ferris, in the perioperative procedural area at Chandler Hospital. And my learning goals was to work with the nursing staff in the OR procedural area for the educational trial of the new product, the Bear Paws, to replace the Bear Hugger that they were currently using to maintain normothermia during surgical procedures. So my learning objectives were to evaluate the current method of use for normothermia and to analyze and compare the data on the new product versus the current product used for normothermia, and to assist in training the OR and procedural area staff on the new product for the normothermia. So how this was accomplished, so I analyzed temperatures prior to procedure and intake, during the procedure, and in recovery on the current use of the normothermia product, which we are currently using, are the Bear Huggers. So I analyzed the data for 1 week on temperatures for those, and then I analyzed temperatures prior to procedures and intake, during the procedures and recovery with the Bear Paws for 1 week as well. I assisted the reps in showing how to properly use the Bear Paws in pre-op and then during the procedure and recovery area. So in comparison, the biggest thing was and what I saw in my practicum experience was that the biggest thing was the patient's safety and quality control for the readings of the normothermia, trying to obtain the normothermia temperature, which is 37 Celsius, which is 98.6 Fahrenheit. And then the benefits of pre-warming. So in order to get benefits of pre-warming, you have to have to increased in body temperature anywhere between 2 to 4, anywhere between 1 to 3 degrees above normal temperature, so that patient's body temperature does not decrease during the procedures when their body is exposed or their core temperatures go down for any reason. Prolonged procedures, which also could create surgical site infections, other comorbidities, and healing processes after the procedure. So what I was compared it to the reading that I was doing in the literature, which it was kind of hard to do because where I did the residency program, I didn't have to do a lot of the reading, but the reading that I did do, I learned it goes along with the ways to better improve quality care and control and patient-centeredness. And I also observed in my practicum that we did, I sat with my preceptor and we did a swarm, which if there's an incident of patient harm or close to patient harm, if there's a way that we can better the environment for patient safety, they have a swarm. Everybody who was in the room during this incident would be invited. They go over our protocols, procedures, policies to make sure that everything is being done appropriately, where the fail-safe happened, and that way we can learn from it and take action from it to better safety control patients. So for the Bear Paws and the Bear Huggers, the best practices after analyzation of the data of the old way, which was the Bear Hugger, and versus the new way of the Bear Paws, the temperature results on average was 0.02 degree difference. So not a lot of difference between either one, the Bear Hugger and the Bear Paws. So some of the cost. So the cost of the Bear Hugger per patient is $5 a piece. And the Bear Paws, which is the new product that we were trialing, was $12 a piece. So it's a $7 difference. So some of the pros to the Bear Paws is, patients can control the flow of air themselves. There's a little dial, and I have a picture I'll show you, and it shows, they can do either warmer or cooler. If patients get too hot, they can control the temperature themselves, so they have more control over it. As where the Bear Huggers, it's on one setting and they can't do anything whatsoever. Another pro is that the Bear Paws covers the whole entire body, and it can maneuver from Whether you're doing a procedure that's upper half, it can be folded down to cover the lower half. And if you're working on the lower half, it can fold up and create a seal to do the top half as well. And then it also transitions from intake to procedure to recovery, where the bear hugger does not. It's a blanket. You can't do much with it. Some of the cons of the bear paws, and most of the patients and the nurses that said that when the air is not blowing, the patient becomes sweating, which can also affect whether they get chills when they go into the OR or procedural area. So that's not a good thing. So the new blower was not, and also one of the cons was that the bear paws blowing machine was not adaptable and was not formulated to go into the OR. So we had to still use the bear hugger machine in the OR and then switch it back. So in the end, they decided to stay with the bear hugger because it was more cost effective, and they didn't see a difference with the control of the normothermia, so it wasn't in their best practice to change to a different product. So here's some examples of the bear huggers versus the bear paws. So this is the bear hugger. As you can see, it's a blanket, so it only covers like half the body, and it doesn't really, maneuver with the patient very well. And this is the machine that hooks up to the end of it and just blows the air constantly straight in it. This is the bear paws. So the bear paws is more like a blanket or gown. It's more like a gown, and it has several hookups. So you can hook it up here, you can hook it up here, and it blows in different sections depending on what procedure they're having, whether it's an upper half or a lower half of the body. And this is the bear paws machine, which you can tell has the little controlling device that you can adjust it as needed yourself, which the patients really enjoyed that. So reflection on my personal effect on my practicum, I really enjoyed working with my preceptor, Kim Ferris, in the perioperative area. She was very educational, informative. I really learned a lot from her, to the point where I may go into education one day, who knows. So, and then since I work in the endoscopy unit, we do procedures, but patients aren't there, the procedures don't last very long. So what we don't use bear hugger, we don't use the bear paws, we use the just warming blankets, which doesn't last very long, and we usually end up using 5 or 6 blankets per patient to keep them warm, and sometimes when it's prolonged. So, and I learned also that the importance of pre-warming really affects, the chances of patients protecting them from surgical site infections. 30 to 60 minutes of pre-warming can really make a big difference. Thank you, and these are my references.